Hello everyone, my name is Jillian. I was an intern. This is actually my second time interning at the Phillips County Hospital and Medical Clinic. The first time was a little rocky. They switched the person that was in charge of us halfway through. It was a good experience, but it was very eye-opening, very, very, very fast. So I decided to do it again, apply for it again, and I got the job. So a little bit about me. I'm currently enrolled at Florida State University, majoring in biology with an emphasis in pre-med. I'm hoping to become a family physician, and my main goal is to return here and be a family doctor in Phillipsburg. I grew up on a farm just right out of town. I'm very involved in the community. My parents actually own Bull Farm and Auto, where Isabel works. So I have been very busy this summer trying to get everything ready. So this is the hospital internship. Like I said, it's my second year. The first time I followed around many different positions, and this time was more focused on what I wanted to go into. So I followed the providers and got a pretty good idea that that's what I want to do for sure. I did learn that the providers here, like the patient isn't just a number, it's not just a room. They know them. They know this person does this for fun in their free time. This is their family. This is who they enjoy spending time with. They like gardening. They make jam. Like, they really know their patients. And that is one of the reasons that I want to return to a small area to work. So like I said, I spend most of my time with the providers. On June 14th, Shelly Cody allowed me to help assist in wrapping a foot with a wound on it. I thought, oh man, I might get uncomfortable with wound care, but I was perfectly fine with it. It didn't bother me at all. On June 17th, I rounded at the nursing home, so that just gives me a little bit of a better idea that I'm not only working with people that can come in through the community, I will be working with the elderly in assisted living or in a nursing home. And then I watched Dr. Weisinger perform a staple removal procedure to a patient's throat. My first year, I was an intern. I was following Shelly Cody, and she and the patient talked, and they thought it was okay that I could remove a staple on the patient's head. And I felt like, oh my goodness, that is a lot all at once, because I had never done any of that before. But the patient that we worked with the throat wasn't very comfortable with the procedure there, so we decided I probably shouldn't, which is probably a safe bet. I don't know how well that would have gone for me. And then I did watch some like wellness checks, kind of that stuff, and then I got to clean out all the supply cabinets that had like medications that they can give out for people to test. So that was kind of fun because I could be really organized. I was in radiology on the 8th. I was only in radiology one day. It was fun, but not my cup of tea. So I worked with Katie Van Allen. She is phenomenal. She taught me so much that had to do with radiology. She explained, I'm not good at pictures, I'm just going to throw that out there. I'm in 4-H, you would think I'm better at it, but I'm not. So this photo I found online, but it kind of gives you an idea of what we were kind of looking at. The colored images is blood flow. So you see which way the blood's flowing, how much blood is flowing. And she kind of explained it like if you're watching the Weather Channel and you're looking at the radar, that's kind of how you look at it. So that was pretty interesting, I thought. Then we went to Leadership Day. That was really fun. We did a lot of team building exercises. I don't know if many interns here did that or not, but that was really fun. We learned about leadership and what it takes to be a good leader and what it takes to be a not very good leader. I worked with the CEO on July 20th, and then I worked with him 2 days later, and we had some board meetings, and that was really fun. So we interviewed a CFO for the hospital. I attended an auxiliary meeting. I presented at the I didn't present, but we presented at the all-staff meeting, and then they had a department manager meeting. And I learned about so many different roles throughout the hospital that you don't really think about when you're just in one specific area. I was also in surgery. I didn't feel like you guys wanted to see very graphic images, so I got some offline again. On the 22nd of June, I followed Dr. Schultz, and he was performing colonoscopies. My first year, there was an intern that was scheduled for surgery, and she watched colonoscopies, and she's like, oh my goodness, it was so terrible, you'll never want to see that. And I was like, oh good, I won't have to. And then I get in there, and we were watching colonoscopies. And I was like, oh man, we're watching colonoscopies. But it was fine. It was a very interesting thing to see. I don't know if I will ever get to see that again in my future, but I'm glad that I did. They kind of explained polyps to me that they find, and I thought, oh my goodness, that would have to hurt the patient so much if they're just going to rip it off, you know. But the patient can't feel anything, they assured me of that. And then the 15th of July, I followed Dr. Nielsen, and he performed a carpal tunnel. And then Dr. Malawi Lewis, she's a new surgeon that comes to Phillipsburg. She performed some colonoscopies and an EGD. And then EGD is this picture, so you take a scope and go down through the mouth and into the stomach. And I told Emily, she was with me that day. The patient was under anesthesia, of course, and she started gagging. And I looked over at Emily, I was like, I'm a sympathetic puker. Like, this could like south really fast. Thankfully it didn't. But I was a little scared there for a little bit. And then on June 15th, I was an outpatient. They were working with cardiology, so we had Dr. E, is what they called him. I don't think I could pronounce his last name very well. It's Ishtracio or something like that. I don't know. They said, his name's Dr. E, that's what we call him. So I was like, all right, sweet. He explained Jardiance to me. I had heard the term thrown around a couple of times. Had no idea what the drug was. I thought, okay, well, it's a drug name, I'll have to learn it down the road. But he kind of went in depth. He told me it was an infancy drug. They made it for diabetes, kind of cure it, and it doesn't really do much for diabetes at all. It stops kidney and heart failure, is what the drug does. But where it does that, it is super expensive. So many people in rural areas can't afford it. So that was kind of a bummer, I thought. Why have a drug that people can't afford? But I also got to sort some paperwork and make copies of papers that Dr. E would take and then that we would keep. And that is it. I just want to say thank you to both County Hospital and Nex Gen for this opportunity a second time. Are there any questions? No?